Ovarian cancer is known as the silent killer because it often has no obvious symptoms until it reaches advanced stages. Each year, more than 19,000 women in the U.S. are diagnosed with ovarian cancer, and nearly 13,000 lose their lives, according to the American Cancer Society in 2023. But here's the terrifying part. Many women ignore the early warning signs, mistaking them for minor digestive issues, aging, or stress. By the time they realize something is wrong, the cancer has often spread beyond the ovaries, making treatment much harder. And if you're a man watching this, don't click away. You probably know a woman, your wife, your girlfriend, your mother, your sister, or your daughter, who could be at risk. Recognizing these signs could help save her life. Today, we'll uncover 10 unusual signs of ovarian cancer, with number 1 being the rarest and most ignored. Catching these symptoms early could save tens of thousands of lives. Number 10, persistent bloating. Most women experience bloating occasionally, but consistent, unexplained bloating over several weeks could be an early sign of ovarian cancer. A 2017 study found that over 70% of women diagnosed with ovarian cancer reported bloating as one of their first symptoms. This type of bloating is caused by tumor-related inflammation and pressure in the abdomen, making the stomach feel constantly swollen or distended. Unlike regular bloating from food, this symptom remains constant and does not improve over time. Number 9, feeling full too quickly. Do you feel stuffed after just a few bites of food? This could be an early warning sign of ovarian cancer. Known as early satiety, this symptom occurs when tumors put pressure on the stomach, reducing its capacity. A shocking 2019 study found that women with ovarian cancer were twice as likely to experience early satiety compared to those without the disease. If you find yourself eating significantly less than usual but still feeling full, and especially if it's paired with bloating, it's a sign your body is trying to tell you something. Number 8, frequent urination or sudden urgency. Running to the bathroom more often than usual? Ovarian tumors can press against the bladder, making you feel like you need to urinate constantly, even if your bladder isn't full. A 2021 study reported that 40% of ovarian cancer patients experienced increased urinary frequency before their diagnosis. This symptom is often mistaken for a urinary tract infection, but here's the difference. It doesn't come with burning or pain. If you feel the urge to pee all the time and there's no sign of infection, it could be something more serious. Number 7, chronic lower back pain. This is another overlooked symptom. Ovarian tumors can press against nerves in the pelvis, leading to persistent lower back pain that doesn't improve with rest or stretching. A 2018 study found that 1 in 3 ovarian cancer patients reported unexplained lower back pain before diagnosis. Unlike typical muscle soreness, this pain tends to be deep, persistent, and sometimes radiates down the legs. If your back pain has no clear cause and lasts for weeks, it's time to investigate. Number 6, changes in bowel habits. Suddenly dealing with constipation or diarrhea when your digestion was normal before? Ovarian cancer can affect the intestines, leading to unexplained changes in bowel movements. A 2020 study in the International Journal of Gynecologic Cancer found that gastrointestinal symptoms, including constipation, diarrhea, and general discomfort, were reported in over 50% of women diagnosed with ovarian cancer. These changes happen because the tumor can press against or partially block the intestines, interfering with digestion. If you notice persistent bowel changes that last for weeks, don't dismiss them as simple digestive issues. Before we move on to the top 5, get this strange fact. Some women are at significantly higher risk for ovarian cancer, while others may never develop it at all. A 2022 research by National Cancer Institute shows key differences between these two groups. Higher risk factors. 1. Family history. Women with a family history of ovarian or breast cancer have a much higher risk. 2. BRCA. Gene mutations. BRCA1 and BRCA2 genes help repair DNA and prevent cancer, and mutations in these significantly increase ovarian cancer risk. 3. Endometriosis. This condition, where tissue similar to the uterine lining grows outside the uterus, raises the risk. 4. Never giving birth. Women who have never had children are more likely to develop ovarian cancer. Lower risk factors. 1. Multiple pregnancies. Having had one or more full-term pregnancies reduces ovarian cancer risk. 2. Oral contraceptives. Long-term use of birth control pills has been shown to lower risk by 50%. 3. Fallopian tube removal. Studies suggest that removing the fallopian tubes greatly reduces risk of ovarian cancer. Understanding these factors can make all the difference in early detection and prevention. With that in mind, let's move on to the top 5. Number 5. Unexplained weight loss. If you lose weight rapidly without changes in diet or exercise, it could be a warning sign. A 2019 study found that significant, unexplained weight loss was observed in 36% of ovarian cancer patients before diagnosis. This occurs because ovarian tumors can alter metabolism and reduce appetite, leading to a dramatic drop in body weight. If you've lost more than 10 pounds without a clear reason, it's time to see your doctor. Number 4. Pain during intercourse. Pain during sex, known as dyspareunia, is often overlooked but can be an early sign of ovarian cancer. Tumors growing near the reproductive organs can cause nerve irritation and inflammation, leading to discomfort or pain. A 2021 study in the Journal of Sexual Medicine reported that 28% of women diagnosed with ovarian cancer experienced persistent pain during intercourse before their diagnosis. If sex has become painful and the discomfort isn't explained by infections or hormonal changes, it's worth investigating. Number 3. Extreme fatigue. We all feel tired sometimes, but persistent exhaustion that doesn't improve with rest could be a warning sign. Cancer-related fatigue is different from normal tiredness. It's overwhelming, making even simple daily activities feel draining. A 2022 study found that over half of ovarian cancer patients reported extreme fatigue months before diagnosis. This happens because cancer cells drain the body's energy by altering metabolism and triggering inflammatory responses. If you feel constantly drained for weeks despite getting enough sleep, don't ignore it. Number 2. Abnormal bleeding. Ovarian cancer can disrupt hormone levels, leading to irregular menstrual cycles or unexpected vaginal bleeding. For postmenopausal women, any bleeding is a major red flag. A 2018 study found that postmenopausal bleeding was one of the earliest reported symptoms in 15% of ovarian cancer cases. While irregular bleeding can be caused by many conditions, it's crucial to rule out ovarian cancer, especially if it happens suddenly or without explanation. Number 1. Enlarged or hard-feeling abdomen. This is one of the rarest and most ignored signs of all. If your abdomen appears visibly enlarged and feels firm or hardened, it could indicate fluid buildup in the later stages of ovarian cancer, known as ascites. This can occur when cancer cells irritate the lining of the abdomen or block the lymphatic system. A 2020 study in the European Journal of Cancer found that ascites was present in 60% of advanced ovarian cancer cases, yet many women dismissed it as sudden weight gain. Unlike bloating, which can come and go, this type of swelling steadily worsens and may cause noticeable discomfort or breathing difficulties. These weird signs of ovarian cancer often go unnoticed until it's too late. The key to survival is early detection. Over 90% of ovarian cancer cases caught in the earliest stage are treatable, but most women don't recognize the symptoms in time. Pay attention to your body, and if something feels off, don't wait, get checked.
And there you have it. What are your thoughts? Next, dive into this video for more essential tips to transform your health and help you thrive. You're going to love it. Thanks for watching Healthy End, and we'll see you there.